welcome to this lecture on the level 3 visit. So in this lecture, we're going to talk about level 3 new patient and established patient, how to use medical decision making, and just kind of everything about level 3 visits. So when it comes to level 3 visits, don't do it based on time. You should always bill based on medical decision making because it's incredibly simple. Okay, there's an image that I'll scroll down and show you in a minute that details all this kind of stuff, the medical decision making and what you need for every column or category of medical decision making to meet the requirements. So when it comes to medical decision making, you have to meet the criteria of 2 of 3 different columns. Okay, I always try to meet the columns of number and complexity of patients and risk of complication and morbidity mortality. So column 1 and column 3. And that's these ones right here. So number and complexity of problems addressed, and then risk of complications and or morbidity mortality of patient management. I try to do these ones because they're simple, right? Sometimes I'll cross over and do the test or complexity of data here, but for a level 3, all you need is 1 stable chronic illness or 1 acute uncomplicated illness or injury. And then you need, ordering of each unique test, review of test results from each unique test. That kind of stuff can be done really easily. Low risk of morbidity from additional diagnostic testing or ultrasound treatment, right? So this is kind of like, hey, I'm going to write you a prescription for cough syrup, or I'm going to tell you to go pick up over-the-counter medication, that kind of stuff. Or we're going to do strep testing, or we're going to do simple x-ray or something like that, okay? So an example of a level 3 visit is somebody comes in, they have a cough, cold, runny nose, that kind of stuff. You're going to prescribe them some cough medicine. You're going to test for strep. You're going to test for COVID, whatever it may be. That's meeting 2 of these 3 columns, right? So 1 acute uncomplicated illness, right? They come in for the URI, okay? And then it's low morbidity, mortality from additional diagnostic testing or treatment, right? There's a really low likelihood that they're going to have more problems if you do more testing. So that meets those 2 qualifications right there. You do a strep test or a COVID test, it meets this one, that's all 3, okay? So what I like to say is a URI with a prescription for cough medicine, boom, level 3, because that's meets this, or if you do any other testing at all, it still meets that, okay? Or 1 stable chronic illness with prescription drug management, okay? You say a patient comes in, they're just there for their high blood pressure, and that's literally all they have. They're super healthy, they just have high blood pressure. So that 1 stable chronic illness and, some prescription drug management over here, that kind of stuff, that meets the criteria for box or column 3, okay? So when it comes to medical decision making, column 1 is just the amount of problems they have, what kind of problems they have. Column 2 is the data you review, the communication with outpatient, with other providers that you do regarding that patient. And then column 3 is essentially prescription drug management, decision to do medication outpatient, decision to send them to the hospital, decision on minor surgery. So basically when it comes to column 3, you're thinking prescription drug management only, okay? All right, so when it comes to the level 3, do not do it for time. Only use medical decision making. Using time-based billing for a level 3 is a waste of your time. Level 3 visits can be done in 2 to 3 minutes, easy if it's an upper respiratory infection and you're using medical decision making, okay? You just have to make sure that you're documenting the requirements, okay? So you need to make sure you're documenting 1 stable chronic illness, 1 acute uncomplicated illness, one of those types of things, right? Hypertension, URI, something like that. And then you are documenting that you're going to prescribe cough syrup, or you're going to order a COVID test, strep test, and you're going to be reviewing that test, okay? Or you can just say, strep test ordered today, it was negative in clinic. That implies that there was an interpretation by you. So when it comes to level 3 visits, a established level 3 visit, 99213, is 1.3 RVUs, WRVUs, okay? When it comes to a new patient visit, 99203, that's 1.6 WRVUs. So a little bit better than a level 2, right? About twice as much, but still not as much as level 4, and we'll show you that in the next video. But anyways, when it comes to medical decision making, start getting used to the idea that 1 stable chronic illness or 1 acute uncomplicated illness with some prescription drug management, reviewing and ordering of tests becomes level 3, okay? That's a level 3 visit. I bill a couple of those a week. I did more when I was working in a clinic with the younger population. It seems like the younger population usually gets more of that kind of stuff. My older population now, I almost never bill level 3 because everybody's got multiple problems, right, in the geriatric population. So anyways, take a look at this this chart down here. You can Google this chart so you can get it bigger. I would highly recommend saving that. And then in the downloads section, there's another basic summary of this kind of thing. So take a look at that. If you have any questions, let me know. But this is the holy grail of medical decision making right here. This chart will walk you through medical decision making. This plus the download section chart that I made you will walk you through this. So thanks for watching. We'll see you in the level 4 video.